The United States spends massive amounts of money for its health care, but the World Health Organization ranks the U.S. 37th overall, surpassed by #1 France and its neighbor Canada, ranked 30th.
If we don't do anything, we're going to see increases in the number of people who are uninsured, what we've seen already in this recession.
47 million Americans are uninsured, and millions of others are vulnerable to morbidities that have decreased in other developed nations. President Barack Obama is pushing Congress to introduce legislation that would provide health care to all Americans.
If we get everyone in the system from the get-go, we make sure that people have the preventive care they need, that they have a usual source of care, they're going to a doctor, and that care is all coordinated. You need to get everyone in the system from day one. And I think
in the past, Mr. Obama has favored a single-payer health care system and insisted that anyone pleased with their current health care plan can keep it. But the current plan he's encouraging now is a departure from his previous plan, this one being a compromise between what he wants and a plan he feels can win over resistant lawmakers. Republicans oppose legislation for single-payer health care, and private insurance companies have lobbied to discourage lawmakers from adopting such a system, fearing they would be put out of business. Many blue dog Democrats, such as Senator Max Baucus, have also resisted a single-payer plan.
This is where the president, I think, is really running into trouble. The first thing to remember about what's going on is everybody in America gets medical care. What happens, though, is some people don't have the health insurance to pay for it, so it gets picked up by the rest of us through tax-funded programs or added on to the cost of our private health insurance.
President Obama's looking for a way to change the way health care is run, much like Secretary of State Hillary Clinton did when her husband was president. However, she was unsuccessful, and Republicans are viewing this recent push for reform as Mr. Obama's Achilles heel.
This is about getting the policy right. This is about getting the policy right. We don't wish anyone ill. We want to get the policy right.
I won't sign it if that reform adds even one dime to our deficit over the next decade. And I mean what I say.
This week, thousands are expected to rally at the nation's capital in support of a single-payer health care system. Their hope is that their voices will be heard and influence a final vote on a health care reform bill from Congress. For Press TV, Colin Campbell, Washington.